Once upon a time on earth, Manav used to do a lot of things every day. He used to go wherever he wanted to go, enjoying the cool breeze of air that comes in the evening, eat whatever he wanted to eat without any suspicious, watch movies in theaters, jogs in parks. Good old days, right? Yeah, I miss them too. Corona or COVID-19 is a name that needs no introduction for entire humanity. Corona made every impossible thing possible, and it had paused the world for a brief period of time, crashed the economies and prisoned the humanity for a brief period of time and made them feel scared of even to breathe. Whereas all other species were enjoying the absence of humanity, humans are still suffering with the effects of COVID-19. We have been through a very devastating first wave of the disease, and now we are in second wave. Though things seem to be normal, they are not. We are still under the fear and we are waiting for a hope, a vaccine. Since the strike of pandemic, we have been eagerly waiting for the arrival of cure so that we can resume back our life normally with safe assurance. We always kept hearing that it's coming, but it always looked a mile away. But worry not, it's coming really this time. Just like every other international issue, making the vaccine also turned out to be an arena of competition between countries. Everyone started the race to bring out the vaccine not for the humanity's sake, but to be remembered as the vaccine creator in the history books. As many as 25 corona vaccine candidates, including Moderna, AstraZeneca, BioNTech, Novavax, Sinovac, CanSino Biologics, and Bharat Biotech are in human trial stages. Russia had already declared its vaccine and it is even ready to give it to their people. It's even having supplies to spread it all over the world. But people are still doubting on that vaccine because that had not yet cleared the third stage of trial. So we are still at a pandemic and we are not ready to face another one soon now. So benefit of having the doubt is just for our safety. America and India are also in the third stage of clinical trials of this vaccine. Russia is looking for the partnership with India to release its COVID-19 vaccine Sputnik V, said by RDIF CEO Kirill Dmitriev. Australia has secured to access the promising potential coronavirus vaccine. The Prime Minister Scott Morrison already said that the country would manufacture and offer free doses for the entire population. The country had already dealt with the Swedish-British pharmaceutical company that is AstraZeneca, which is to receive COVID-19. It is developing with Oxford University. Other nations are also on their way for preparation of this vaccine. But why it is taking this much time to create a vaccine against a little virus which can be washed with your soap or sanitizer? So this is where you have to understand or you have to learn a little lesson of your biology. So this COVID-19 uses its strands to stay on our surfaces. When you are washing your hands or using sanitizer, it is just sweeping away from your surface, but it is not getting killed. Coming to the sanitizers. All formulations and dilutions are 40% or more than kill the coronavirus and reduced them to the background within 30 seconds. The two WHO formulations are having the COVID-19 reducing factor of 3.8% greater than it, or the modified version is having greater than or equal to 5.9%. Both ethanol and 2-propanol were effective in reducing the coronavirus to its background level within 30 seconds with a reducing factor of 4.8 to greater than 5.9 or equal to it, and it is effective with the ingredients of 30% or greater than it. It had worked on the disease SARS-CoV-2, that is the reason for the cause of this COVID-19. But this is highly strong to consume, so we have to look after something else. Thus, creating a vaccine that should be as strong as a sanitizer but it should not affect the human being is the reason behind all these tests. So let us see what goes behind preparing a vaccine. The general stages of development cycle of a vaccine are exploratory stage, next preclinical stage, clinical stage, and regulatory and its review, and later on approval, and next quality control and manufacture. Clinical development is three-phase process. In phase 1, the vaccine is given for a few people, and in phase 2, the number of people will be increased based on the characteristics such as age and their physical health. And in phase 3, the vaccine is given for thousands of people and tested for their efficiency and safety. Many vaccines undergo stage 4 formal ongoing studies after the vaccine is approved and licensed. So to cross all these things, it takes a lot of time. So till then, stay safe and don't forget to wear your mask, and yeah, sanitize yourself and maintain social distancing. Jai Hind.